Welcome back to day two. Today we're talking about patient materials. The requirements for patient materials shouldn't take as long as the education orientation did. Hopefully this will be a really quick video, and then if you have any specific questions, we can drill down into that more. So the areas of patient materials that we're going to talk about are fees and what's provided by you. So fees and services, which they should be signing and acknowledging upon admission. So they're going to want to see that the patient has received a notice of the charges that they'll be billed for and the services that come with that. So for Medicare hospice, they're going to want to see $0.00, and the patient acknowledges that in the line below that cost, or on that form. That disclosure when they're doing their election of benefits and admission, they're going to want to see that the patient's been presented with that. Specifically, we've had surveyors ask for us to amend that form that it needs to have $0 as the amount on the form. So that's one of those weird requirements that you have to be right on top of, or you could easily be penalized for that. So that's one area. They want to see rights and responsibilities were provided to the patient on admission. So they will ask for the admission packet when they come on site, and they'll expect that those types of forms are in there. So they'll expect to see your admission paperwork. They'll expect to see a fee disclosure. They'll expect to see that patient rights and responsibilities were provided. For hospice, they'll expect to see that you allowed them to have notice of an attending physician election, how to file a grievance or complaint. So in your admission packet somewhere should be a letter stating what your process is for how you resolve complaints, and that it should include the number to your accrediting body or your regulatory body if you're not seeking accreditation. So it should have the number. If you can't resolve your concern, you have the right to reach out to ACHC at this number, the state of whatever state you're in at this number, Department of Health. But there has to be contact information for how they can reach those regulatory bodies with any complaints that they might have. Excuse me. The other area is they're going to want to see that the patient was provided information on emergency preparedness at the agency. This is an easy one to get dinged on. It happens a lot. But so what we do, the hospice I'm working with here in Hawaii, they provide a Hawaii Elder emergency packet in their admission packet, and the surveyors loved that. Absolutely loved it, said it was amazing. And it's literally just a packet that we printed out, or they printed out, about the state's emergency preparedness and how elders could get help, and how those things are communicated, and how to be better prepared for emergencies. So you also want to include that in your admission packet, how your agency communicates emergency preparedness, how they can expect to be communicated with in an emergency. The other area is biohazard waste. I know this is strange, but this is one of those little areas that I wanted to mention because at least for ACHC and I believe CHAP, they want to see that the patient has been notified of how to, so certain admission education occurred upon admit. So they were educated on, how to contact the nurse after hours. That's a big one. They want to see your after hours on call, especially, for hospice 24 hours, call hospice first. They want to see that. They want to see how to reach a nurse. They want to see how to reach the office, or the office hours are posted. They want to see that biohazard waste materials were educated on. So an example of a really easy way to do that is we just have it in the kind of template in the chart that says Family, patient, and caregiver were provided education on how to safely dispose of contaminated materials or biohazardous waste, and to contact the whatever entity you want to put there. Could be the hospice, could be the home health, could be the state, could be the vendor, whoever. If you have pickup, if it's the on-call nurse, they need to call on-call to have them come and pick up the biohazard waste. If it's just double bagging it and putting it in the garbage, that's one option. So it's just whatever depending on what your requirements for your state are, and how your agency handles that should be somewhere in the admission education. The other area, I'm just checking my notes here, is written instruction on their schedule and medication. So for home health, they're going to want to see that was provided to the patient on admission, that they receive that information on their medications, their schedule, and like I said, how they can reach the office, what their plan of care is going to be. So they want to see that those things have been reviewed with the patient, so the patient is included in the plan of care. They always want to see that the patient has been included in the plan of care. So that's a big area for survey, that the education has been done on admission. This is my big fat notebook. So that's another area that you want to make sure is reflected in your admission note. Any education that was done with the patient on admission is going to be huge. For hospice, they're also going to want to see in that admission that pre-bereavement assessment was done at the time of admission. So that's not necessarily a patient-provided material, but they're going to want to see that screening was included in that admission assessment. And that's an easy area to forget. So I always put in a plug for that because it's an easy tag to get. So those are the main areas of patient materials that they're going to expect to be in your admission packet. Make sure when you hand them an admission packet that it's complete, that it's up to date, that you've reviewed that all the materials are in it. When we start talking about items needed for survey, I would recommend starting to build your binder of, anything that you're going to need to have ready. A lot of times this can just be your Google Drive. The organization that I'm working with right now has a Google Drive survey shelf, and all of their policies and procedures, all of their licensure, everything is uploaded into that Drive folder for easy access. And I highly recommend doing that if you're not going to have it on paper to hand them. I would definitely have it somewhere where you can print it all at once in one place, and you're not searching around for different things that you need to find to try and give the surveyor. So hopefully I covered all the patient material items. We went over that kind of quick. And if not, just let me know if you have any questions in the comments, and we'll be doing postings and notices tomorrow. So day 3 is postings and notices. And then day 4, expect to be a longer day. I think it could run into 15 minutes for personnel files for sure. So get any personnel file issues or questions you have ready for me for day 4, because I know that's a topic that a lot of people struggle with. So I want to provide as much helpful information as I can on that to help you on the right track. Okay, thanks.